And we're back with another recovery of the month with Fortress. Thanks for joining in. This is Dr. Amy with you guys here today. Welcome to the channel. If you haven't already, I would appreciate if you could subscribe. There's some pretty cool content I've been putting out. Simple, free to your fingertips, and hopefully education along the way that you can take with you and help improve your health, wellness, fitness, and recovery pathways. Okay, so we're gonna get right to it. Today's movement focus of this month is going to be in the neck and the shoulders. Again, full disclaimer and disclosure, these movement routines aren't meant to replace any healthcare provider recommendations. So you are performing these on your own. Just make sure you have a physio in your back pocket. I think that's something that is advisable to have in order to help build a better, robust body. So on my handy dandy whiteboard over off to the side, we're gonna be, you will need some type of pillow or something soft. I would prefer to kneel on. I have my towel or blanket. So in today's routine, we have 1, 2, 3, we have 4 different movements today. And again, pending your time constraints, somewhere between performing maybe 2 to 4 cycles of this. 2 might be sufficient for you. Again, we're gonna focus on the neck, which will then translate into the shoulder and a little bit of that upper mid-back area. So first movement is repeated neck retraction into extension. We're gonna do 5 of those, but these are gonna be nice and slow. So we're gonna get into this tall kneeling position or on your knees. And all we're gonna do, we're gonna think our nose and our chin are parallel to the floor. And when I kind of incorporate and teach this movement to my patients, I want you to think if someone was coming at you with a pie and they were gonna pie you in the face and you have to get away from that pie. Or perhaps if someone has really bad onion breath and they wanted to give you a big smooch on the lips and you're like, I'm not touching that. So retraction is when our nose and our chin are parallel to the ground and we're in our normal resting posture position. So you can see me from the side here. And I'm gonna retract my neck. So I'm gonna kind of make like a double chin. Do you see that? Double chin. So we're gonna get into retraction and then we're gonna look up into what we call extension. So it's gonna be double chin and then just nice, easy look up and then naturally come out of that position. We're gonna do 5 of those. Double chin. I'm gonna turn to the front here. Some compensations that I see, I'll see people shrug their shoulders. No. I don't want that. I want double chin. Two more. Probably feel that nice deep stretch in the front when we look up. As we retract back, you might feel that stretch like in the bottom of your skull. That's good. We want that. All right, I did my 5. We're already gonna get into our next movement. All of these movements are gonna be in this tall kneeling position. So next one is shoulder cars, forward and backward. Cars means controlled articular rotations. So it's basically slowing down range of motion in order to achieve more range of motion. And then you're able to figure out if there's a difference from right or left sides. So I'm gonna start with my right arm. I'm gonna try to maintain a fist entirely, a nice strong fist, and my goal is to keep my arm as straight as possible. I'm gonna slowly reach forward, reach up, create a big circle, rotate my fist kind of towards the outside, and then come back to that start. I'm gonna do 5 forward like this. Reach. So as you can see, I'm trying not to like really rotate my trunk. My goal is to get into this ball and socket joint of the shoulder and really maintain focus with that. Because a lot of shoulder movement can coincide with neck issues and vice versa. After you finish those 5, you're going to reverse it. So instead of going forward and back, we're going to go back and then forward. So coming back, that's usually a sticking point back there. You can see me from the side, kind of this angle. Try not to let my trunk rotate, right? I don't want to see a lot of this, right? That's cheating. You're not really getting range of motion into your shoulder. I'm going to do one more, then I'll hit up 4 or 5 on the other side, but the goal is 5. All right, other arm, you can see me starting from the side. I'm going to go forward, so 5 forward, make a fist, keeping my elbow nice and locked. Reach, 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 up, 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 up. Back, 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 back. Again, don't let that elbow unlock, keep it locked. There's probably usually a sticking point in that back aspect of the arc or the circle that you're making. Mine's about right there and there. I'm going to do one more. Again, we're shooting for 5 reps. And then I'm going to reverse it. So I'm going to go back and then forward. I'm going to turn a little bit more to the side here. There, feel that ball and socket do the motion. So our shoulders are just like our hips, right? They're ball and socket joints. Hip is just a bigger overall joint, right? But they're essentially the same thing. They have rotator cuff muscles. They have to have a lot of stability, but yet a lot of range of motion. All right, so we're doing a total of 10, 5 forward, 5 back on each arm of those shoulder cars. Again, we're staying in the kneeling position. Next movement is going to be alternating shoulder internal and external rotation reaching. I guess you can kind of think of this as like almost like a windmill. I don't know. But it is what it's called. So I'm going to show you from the front, and then I'll turn around and show you from the back. But arms are going to stay fists. Hands are going to stay fists. Arms are going to simultaneously get into what we call this external rotation reach, while the other opposing arm is going to get into this internal rotation reach. So this is what it looks like from the front. We're going to do a total of 10, 5 on the right, 5 on the left. So I'm really trying to not let my trunk kind of go forward or forward head, right? Because if we have a forward head, I can't get into this range of motion. If I can open up my chest a little bit more, I can. I'll show you a couple from the back. So my left arm going up is into external rotation, while my right arm is into internal. Now you can see I actually have some limitation going on this side. External rotation on the left, internal rotation on the right. I'm limited. Okay, we're going to shoot for 5 on the right, 5 on the left, just simultaneously going back and forth. And then our last movement, you can totally still continue to use your towel for your knees. I will, since it's already here. I like this movement. We're going to do 5 on the right, 5 on the left, total of 10. It's called thread the needle. Thoracic thread the needle. So we're going to be on all fours. And we're just going to alternate our arms. So I'm going to take my right arm. We're going to be out just a little further. I'm going to take my right arm, slide it under my left, and I'm going to look under my left armpit. Kind of a little exhale here. Feel that stretch in between my shoulder blades. I'm going to come back to this kind of elongated hands and knees position. And I'm going to go left hand. My butt staying high. My knees are stacked underneath my hips, right? I'm not back like this. We're really gonna try to stay in this knee under the hip position. A little exhale when you're at that end range. My bottom arm, I'm trying to stay straight at the elbow. And then I'm just letting the like side temporal aspect of my head relax on the floor. My opposing hand, my stabilization hand, I'm pushing it into the ground. If I want a little bit more rotation, I can push. I'm gonna get a little bit more at the side so you can see this. Right hand, I'm coming under. I'm looking at you. Nice stretch. I'm gonna push into my left palm here that's stable on the floor, this guy. Push while this arm reaches. I feel that nice stretch on the back of my right shoulder blade, or the arm that's on the floor. You can see me from this side. So my arm, left arm that's on the floor, I'm gonna push with my right, kind of slightly too, shift my hips to the left, while my opposing arm is reaching opposite. All right, so that's today's routine, focusing on the neck and then really getting into the shoulder range of motion. 4 movements in the tall nailing position with the exception of the last one. We have 5 neck or cervical retraction extension, 10 shoulder cars, 5 forward, 5 backwards on each arm. And then we're getting into that internal and external rotation simultaneously with the shoulders, really trying to maintain good posture. And then that last one, alternating thread the needle to get that really nice posterior aspect of that arm, nice and stretched and fluid, and pushing some good blood into that area.